Good morning. The Health and Human Services announced a total of over $19 billion in Recovery Act awards to help the healthcare providers advance the adoption of meaningful use and health information technology, also to train the workers for healthcare jobs of the future. These awards are going to help make health IT available to over 100,000 hospitals and primary care physicians by 2014 and train thousands of people for careers in the emerging health IT industry. LA Care has awarded over $3.6 million for HIT projects, which include e-prescribing, quality reporting, and EHR grants. They will soon announce incentives to physicians and groups who are adopting EHRs to offset some of the productivity losses that happen during the implementation phase. Blue Shield of California will also award nearly $25 million based on clinical care performance and patient experience and the use of health IT. No World Borders has recently closed a private equity fund for the delivery of provider and payer solutions for healthcare reform, and United Healthcare announced that they would award $10 million in HIT adoption and EHR implementation for California. Funding is also coming from local associations, hospitals, foundations, and all this money is helping to bridge the financial gap for physicians and clinics. The increase in available funds will be a great support for the early and late majority EHR adopters. The innovators blaze the trail for EHR development and did the majority of their work without the compensation, grants, awards, and support that are now available to the physician community. Based on the recent survey data, LA County physicians have an approximate 30% EHR adoption rate, which initially seemed high to our group, but we're finding that our early enrollment is tracking at about 20%. As with any software that is reaching the larger and larger market share, the price is driven down, and the pricing for the smaller offices that we are supporting, we are estimating per physician EHR pricing is much lower than it was even last year. Hardware is a commodity and can be obtained for lower and lower prices. The only area where we're seeing the cost increases are within the services arena. The HITEC Act seeks to improve American healthcare delivery and patient care through unprecedented investment in health information technology. The provisions of the HITEC Act are specifically designed to work together to provide the necessary assistance and technical support to providers and enable the coordination and alignment within and among the states. They are meant to establish connectivity to the public health community and assure that the workforce is properly trained and equipped to be meaningful users of EHRs. Combined, all of these programs build the foundation for all Americans to benefit from an electronic health record as a part of a modernized, interconnected, and vastly improved system of care delivery. There are grant programs that seek to rapidly increase the health IT education and training programs at the community college level. Colleges funded under this initiative are going to establish intensive, non-degree training programs that can be completed in 6 months or less and help train adult workers that are a burden on our system in the unemployment phase right now. There are also $10 million in grants to institutions of higher learning to support HIT curriculum development. All the pieces of HITEC fit together, and as you look at the diagram here, of their $750 million invested, $386 million will go to 40 states and qualified state-designated entities like California to facilitate the health information exchange at our state levels, while $575 million will go to the 62 nonprofit organizations that are designed to support and the development of the regional extension centers. Our regional extension centers will aid health professionals as they work to implement and use health information technology. The RECs are expected to provide outreach and support and services to at least 100,000 primary care providers and hospitals nationwide within 2 years. The law that requires regional extension centers to be affiliated with U.S.-based not-for-profit institutions or organizations, such as LA Care, were established, and they support the recognition within the local communities they propose to serve. LA Care applied for the grant in 2009 and was awarded the REC grant in April of 2010. LA Care is the largest public health plan in the U.S., and as part of the funding design, the program is set up to have 90% of the funds paid for by the federal government for the first 2 years and 10% of the funds to be donated by the sponsor, which in our case is LA Care. In 2 years after that, the funds switch just the opposite. LA Care would be responsible for 90%, and the state and the Fed will be only responsible for 10%.